Welcome back to our channel, where we bring you the latest health news and breakthroughs. Today, we have an important topic to discuss. If you've been told that diabetes cannot be controlled, well, prepare to be enlightened. There's a common misconception about diabetes and its effects on our lives. Oddly enough, many diabetes protocols still recommend the use of metformin and its analogues. But let me tell you, this is a belief shared by misinformed patients and doctors alike. In reality, metformin is a dangerous path that can lead to illness and untimely death. Yes, it's true. So, if your doctor prescribes you a medication containing metformin, my advice is simple. Run away from that doctor. You see, these drugs actually increase blood insulin levels to critical points. When insulin reaches such high levels, it thickens the blood, making it resemble condensed milk. And in large quantities, insulin causes immense harm to the body. It literally destroys vital organs like the liver, kidneys, and other excretory systems. Think of insulin as stomach acid. Imagine what would happen if stomach acid filled your internal organs. It would burn right through them. Elevated insulin levels corrode cells, leading to abnormal cell division, which is nothing short of oncology. Shockingly, statistics show that 28% of diabetics develop cancer as a result. Moreover, high insulin content leads to rapid clogging of blood vessels with cholesterol plaques. The thickened blood, rich in insulin, moves slower and causes blood vessels to become blocked. Consequently, we see a rise in blood pressure and hypertension, which affects 98% of diabetics. But that's not all. Many other cardiovascular problems start to arise. Let me give you a list of the threatening consequences of metformin-based therapy. Gastrointestinal disorders, including diarrhea, heartburn, belching, and stomach ulcers. Hypertension, characterized by pressure surges, especially in the evenings, along with headaches, stuffy ears, and waves of fear. Cirrhosis of the liver, where the liver transforms into connective tissue, fails to purify the blood, and fills the entire body with toxins. Kidney stones due to the excessive excretion of salts and sugar. Oncological diseases. Premature death due to destroyed blood vessels. Blindness. Now, the extent to which you experience these complications depends on the dosage and duration of the medications you take, as well as your individual characteristics. But let me be clear, you cannot completely avoid these complications. Now, you might be wondering why metformin is still being used if it's so dangerous. Unfortunately, most specialists don't prioritize your health. In fact, I dare say that no one really cares. They simply do their job and get paid for it. Whether your health improves or not is inconsequential to them. That's why they don't hesitate to prescribe products recommended by authorities or ministries. These solutions are based on synthetic components and bring in huge profits. Yes, they might work, but their effects are short-term. No one should fight diabetes with such indifference towards patients. People just don't know the potential consequences of these solutions, and experts don't find it necessary to inform them. Strongly believe that aggressive drugs like metformin should be taken out of production. Moreover, they can't be considered effective, as global diabetes statistics continue to rise. I want more people to learn about the method that truly helps in the fight against diabetes. What are these methods? Leave your answers down below. Patients who have taken metformin for a long time suffer greatly. They fall ill and age prematurely. It's often the case that patients discover they have type 2 diabetes during a routine checkup. Until that point, they usually felt fine and would have never suspected high blood sugar. Then, they are prescribed metformin, sometimes at an increased dosage. Initially, the sugar levels drop, but over time, the person's condition starts deteriorating gradually. Chronic fatigue, obesity, high blood pressure, and headaches become common complaints. Swelling in the legs and face, constant ringing in the ears, numbness in fingers, and cold limbs follow suit. Eyesight deteriorates, and memory suffers. Doctors attribute all these symptoms to diabetes, but in reality, it's all because of insulin. More specifically, it's because of metformin, which pushes hormone production to abnormal levels. But that doesn't mean you have to surrender to diabetes. If you're faced with the choice between taking metformin and enduring the disease, of course, you should choose the former. Diabetes can be a killer if left untreated. But remember, it's not the only symptom you'll have to deal with. Make sure you do not miss our next video on the best way to actually handle diabetes. Also subscribe and like for us to continue bringing you well-thought, researched, life-saving videos like this. That's all for today's video. Don't forget to hit the like button and subscribe to our channel for more eye-opening content. Take care of your health, and remember, there's always hope in the fight against diabetes. See you in the next video.